One of the biggest concerns I hear that women have about breastfeeding is that it hurts. And then you hear that breastfeeding should not hurt, and then when it does, you don't know what you're doing wrong. Let's review. The hormones from pregnancy make your nipples pretty sensitive, and then you have a newborn suckling on them every couple of hours. While a good latch really shouldn't hurt, remember your nipples have never been through this before, and there may be some soreness. The good news is this soreness should pass within 2 to 3 weeks. And in the meantime, you can be using some nipple moisturizer like lanolin or nipple butter to help keep your nipples moisturized and supple. But really, breastfeeding shouldn't be painful, and there's the subtle difference. When the baby initially latches on, there's a stretching of the nipple which doesn't feel great, but after about 10 to 15 seconds of suckling, the latch and feeding should feel doable. If it feels toe curling or takes your breath away or even feels pinchy, the latch is not right and you need to break the seal and try to latch again. It takes some patience and perseverance in the beginning, but as I tell moms, hopefully feeding your baby is your one main job right now. And as I shared before, you get lots of opportunities to practice this. Crying is a late sign of hunger, and it's very difficult to get a hungry baby to calmly and nicely go on the breast with a proper latch in those early days when they're still learning too. Try to catch your baby before they're frantic with hunger. Look for feeding cues where your baby is telling you they are ready to eat. These cues include rooting or turning to the side with a wide open mouth, like if you were to stroke the baby's cheek. Tongue thrusts, sucking, their hands or tongue, or really any mouth movement would be a green light to try to feed. So is wiggling around, or even best of all, quiet alert. The quiet alert state is the best time to quickly check if baby needs a diaper change and then bring the baby to breast for feeding. So now you've been latching and feeding the baby on demand at the breast for a couple of days and you suddenly feel like your breasts have doubled or even tripled in size. You may even start leaking milk, so you'll want to wear nursing pads, which come in a variety of materials and designs. These are signs that the milk is coming in, and the uncomfortable fullness that sometimes accompanies this is called engorgement. The breasts may feel hot and hard, but this should pass within 24 to 48 hours. Here's how to manage it. Feed the baby frequently. This will relieve pressure and also help establish a good milk supply. You can use warm compresses like a wet washcloth on the breast and then massage a little from the armpit area and all around the breast before feeding. If your breast is so full that it is taut, it may be difficult to latch the baby on deeply, so reverse pressure softening at the nipple can help. If your breast is very taut during engorgement and you're struggling to get the baby latched on deeply, you can do some reverse pressure softening. You take your fingers like scissors and put them on the areola and just press back for a few seconds and then switch to a different angle and do it again. Some milk might come out and other milk is getting pushed into the breast, but the baby will drink it and drain it when they get on deeply and suck. If you're still feeling uncomfortably full after the baby has nursed, try not to pump. This will only perpetuate the engorgement. Instead of pumping and telling your body you need all that milk and more, try putting a cold compress on your breast for 10 to 20 minutes after feeding. Baby may also act satiated after the first breast, leaving you feeling full and uncomfortable on the second side. Again, try not to pump the breast, but know that during engorgement, the baby will typically come around for the second breast within the hour. Burping the baby between breasts and diaper changes can help them make room for more food and wake up to eat some more. If you think about how baby's been existing on much smaller volumes of food for a couple of days with the colostrum, then the milk comes in and they drink themselves into a deep, satiated slumber. As soon as they can, though, they rouse to eat more as they work to regain their birth weight, which breastfed babies typically do within 10 to 14 days. All babies lose weight after they're born, but the baby's weight will be monitored and you can use the feeding log to know how things are going in between weight checks. A few other concerns are clogged ducts, thrush, and mastitis. Thrush is an overgrowth of yeast or a fungal infection on your breast or nipple that can be very painful. It's fairly uncommon, but if you can imagine, leaking breasts and wet breast pads are a perfect environment for growing thrush. Try to change your nursing pads often and leave your nipples open to air dry whenever possible. If you do develop thrush, you and your baby will both need to be treated with oral and topical antifungal medications. When treated, it's not really a big deal and just more of an annoyance. Clogged ducts and mastitis are more often a result of an improper latch or not feeding often enough. Keep working on the proper latch for every feed and reach out for help as you need it. In this case, the sooner the better. Avoid ill-fitting bras, especially underwire, even in the end of your pregnancy. Feed frequently on cue, and if the baby is not nursing well, express your milk regularly to maintain your milk supply and keep the milk moving. Massage and manual expression, in addition to good feedings, can help resolve a clogged duct, though you'll probably want to address this with the supervision and guidance of a professional lactation consultant. Mastitis can feel terrible, like you have the flu and your breast hurts. It refers to an infection in the breast, and you should keep feeding the baby as the infection is in the tissue and not in the ducts or milk. Be sure to call your provider right away, as you'll likely need antibiotics, but you'll feel much better quickly after taking them. Continue to feed the baby to keep the milk moving regularly. Breastfeeding is a new experience for many of us. Gather your information and practice, and reach out for help as needed. There are lots of people out there to help you, including myself by phone or Skype.